So I'm going to say something which may sound obvious, but it, it could feel less than obvious as we move through. The principles we will share apply to all types of review, whether a child safeguarding practice review, a safeguarding adults review, or a domestic homicide review. And no matter which type of review you're operating in, I'm going to invite you to think about the fact that you will be encountering themes that we've seen in reviews before. You may say, yes, of course we will. But you may also be encountering themes that have happened in that particular area before. And I invite you for this time that we're together to sit with that, because I know that that brings through a lot of feelings, a lot of thoughts for many people. I've been in a space like this recently, only in August, when people were saying how they felt about that. So I want this to be part of what we do today. Okay, so before I get carried away, which I will, my name is Donna Odidar. My background is as a solicitor. I'm an independent reviewer. I use the SILT methodology. I'm joined by Jonathan Dickens, who is Professor of Social Work at the University of East Anglia. And very shortly, I'm going to ask Jonathan to share with us the work that he's been doing, which made me think he's an interesting person to talk to about this. Okay, so this is your time. Time is one of the most valuable currencies we give to anybody. And I'm very grateful that you're giving yours to us. However, I would invite you to do some things that are going to help to make it even more of a sacred space for you. So if you turn off your distractions, and that might mean your phone, switch off your phone. It might mean close down your browsers. Close your door is one that it means for me. And if you would use the chat box to post your questions and your points, we're going to reserve a lot, and Jonathan's asked to reserve a lot, especially for today, of Q&A time for the end, because he's really interested to hear what you've got to say as well. So the lowdown then, what is this all about and how does it work? So what we're going to do is just enjoy our private space today and use it how we want to. But a summary of the audio from this class, from this workshop, will be broadcast to a wider audience. That wider audience is the Safeguarding and Domestic Abuse Sector podcast. Now, it's absolutely fine for you to let me know in the chat, for you to let us know by email later on today, if you want us to not share any of your contributions or comments. If you think later, I don't really want that on the podcast, that's absolutely fine. There's an editing process which is really good and smooth, and it won't look odd or seem odd. I really recommend you subscribe to the podcast. Its content is designed for us. It's for those of us who work in the sector. And if you want to receive a how-to video because you haven't subscribed to podcasts or you can't remember how to do it, we've got a how-to video. It stars our very own Kelly. And if you just type video into the chat, you can receive that how-to video if you think later on you want to have a listen to either this episode or any other episodes of the podcast. Okay, so that's a bit of housekeeping. Now, we're going to talk about 5 misconceptions. But before that, I'm going to ask Jonathan to share with us a little bit about the work he's been doing, and it might help you to think about the questions you might want to ask too. So over to you, Jonathan. Welcome.
Hello everyone. Can you hear me? Am I all okay? Yeah, great. Well, thank you all. Just echoing what Donna's just said, thank you all for making the time to join us. I know you're all very busy people, and I'm really glad to have the chance to talk to you. I was working out with Donna, the last time that somebody in England could have said, I'm not going to the workshop because it's the Queen's state funeral, was in 1901. So we've got a bit of history, a good excuse. It's 120 years since last somebody could have said that. Anyway, thank you for making the time today. So yeah, what I've been doing over the last couple of years, the work that I've been doing, it links very well with the wider changes that have gone on about the change from safeguarding children boards to local child safeguarding partnerships, the ending of serious case reviews, and they've been replaced, by local child safeguarding practice reviews. The words are very long. I'll just call them practice reviews, I think, to try and save time. Otherwise, we'll run out of time. And the new system of rapid reviews, the practice reviews, and the national reviews, and the role of the National Child Safeguarding Practice Review Panel. So I'm sure you all have seen the Arthur and Starr review. That was a national review. What I've been working on then over the last 2 years, serious case reviews have come to an end, but there were serious case reviews they could be started up till September 19, and then a year to complete them. So colleagues at UEA, University of East Anglia, where I am, have over the last 20 years worked on periodic reviews of the serious case reviews commissioned by the DfE. And I've taken over leading a team of researchers at UEA and the University of Birmingham, and we've done the last ever review of serious case reviews from 2017 to 2019. We've also done a sort of historical overview of all the periodic reviews which cover serious reviews going back to 1998. So 21 years or so of serious case reviews. And we've done the first 2 annual reviews of local child safeguarding practice reviews for the new national panel. So we did the review of 2020 cases, which was published last year. And this year we've done the review of 2021 cases, which isn't published yet. All those reports I mentioned, those 3 reports, serious case reviews 2017 to 2019, the history of serious case reviews back to 1998, and this year's review of practice reviews, they're all written, none of them are published yet. Because you can imagine the people in the DfE and the national panel, they were all completely overwhelmed by the Arthur and Starr case, by the independent review of children's social care, the McAllister one. As a researcher, we send our report into the DfE or whatever, and then we hang about for about 4 months, and then they send us back comments and we have to revise it and whatever. Anyway, they're revised and they're waiting, but they've got to wait for an opportunity to be published. It keeps getting knocked back. I'm hoping they'll be published in November. Watch out for them. I'll let Donna know, and she can circulate people. We have a site with Research in Practice. I'm sure many of you know Research in Practice. There's a free to access site there with all the information about serious case reviews, and there'll be videos of us talking about it as well. So that's the work I'm doing, and that's the work I'm drawing on in answering the questions that Donna's going to fire at me, and I hope you'll fire at me too. I really enjoy the discussion with people at the front line. I enjoy hearing your views and having a discussion with you, so please do.
Thank you, Jonathan. So the reason that I said at the start is about this applying to all 3 types of review is that the language you've just heard from Jonathan talks about children's reviews, but I believe that this is exactly what we're facing in all the 3 types of review that I work in. So if you hear some language that's pertinent to children's reviews, I just want you to know that I'm involved in all 3 types of review, and for me, this is exactly the same thing that we're encountering. So differences in language don't mean a difference in the fundamental principles. So this is applicable to you if that's not your main area of specialism too. Some of the resources I'm going to share later do give a more of a specialism slant to things, which I think will help. So today, these are the points. We'll show you the points that we aim to cover, but we're also really keen to hear from you. We're going to give you a chance to let us know what you want to hear about too, so that we can tweak these a little bit and make them suitable for you. So the local themes and national themes point is important. It's almost something to clear up and get out of the way and differentiate in our minds before we start. So I think that's a good place to start. It'd be great to talk about what happens with vague language and what happens when you use specific language when you're describing your theme. And I think it's also important to talk about the effect of this image of recurring themes, of not really getting anywhere, not really making any progress on the workforce and on others. Final 2 points we aim to talk about, and this might help you to think about what you want to, is reviews which don't talk about the practice. I've got a resource for you to take away if this is something that you grapple with as well. I think we all do. And then this phenomenon with our recommendations to lead to this training recommendation. So there's an idea of what we might cover. I'm going to show a slide now that hopefully will help you to tell us what you want, where you're at. It might not, because you might not be in any one of these 4. And I think if you're not in any one of these 4, type other and tell us where you are. So can you type us a 1 if you disagree about recurring themes being an issue for our reviews? 2, if you have a review which repeats the same theme locally and you really want to use today to make the most of the opportunity to do something different. 3, jaded, reviews are learning the same old lessons. Nikki's a 2 and a 3, Alison's a 2, Louise is a 2. 4, if you're inexperienced, you're here to learn, you're an open book. Katie's 2 and 3, Kate is 2, CB is 2, Eleanor's 4, Robin's a 2 and a 4, Louise 2 and 3, Steve 3, 2 and 3, Catherine's 2 and 4, and Jeff is 3, Paul is 3. Rachel Upton is 2 and 3, Margaret's 2 and 3. Rachel, you're the only person who I've mentioned your surname. If you want me to take that out, I will. It's because I'm used to having 2 Rachels around and having to differentiate them. Margaret's a 2 and a 3. And gosh, there's a lot of 3s. I'm so pleased that we're going to talk about the learning the same old lessons issue, Jonathan. Julie's a 3, Josie's a 2, although it's a positive. Thank you, Josie. That's really interesting. 4, inexperienced. Hopefully we've got things for you then, Emma. Thank you. Yeah, I think that gives us a good starting point, Jonathan. Nikki is a 3. Forgot what 3 was then. Elizabeth's a 2 and a 3. You have a review. Thank you, Elizabeth. And perhaps there's a concern about same old lessons. Okay, we've got some juicy pieces of information there. Let's begin with local themes and national themes. I'm going to start this conversation by saying that when we first started to talk about this, it did nothing but confuse me in that I didn't understand, like hard to envisage what the learning that would be generated would look like under each of those once they became separate. Would we draw all the recurring themes together for national learning, or would we carry on if it was recurring in a local system? And of course, we do now have the Star and Arthur review, and I can give you some headlines from that if Jonathan wants me to, when he has spoken to us, that might help us see in practice. But over to you, Jonathan. So I guess the question is, can you differentiate them for us and tell us what happens when they transfer over? Thank you.
Okay, thank you. And just, I'm sorry to see so many of you in the jaded box, but what I want to say to you, just to address that, you're here now, you are showing me that even if you do get a bit worn out with the same old messages, you're still keen to learn and you're still doing the job. So what I want to say to you is thank you. Thank you for the work you're doing. Try not to be too jaded. It's such important work. And thank you for, wanting to keep learning about it. I think that's really important. Give yourselves a pat on the back. Well done. So about local themes and national themes, I think what happens, what there's a tendency for, when these awful cases happen, like Arthur, like Starr, people say, we've got to learn lessons. We've got to learn lessons. We must prevent this. But looking for the general lessons, the sort of transferable ones you can get out to other local authorities across the country. What happens then, I think, is that it's overgeneralized, and the specifics, the uniqueness of the case gets lost. Now, actually, when you read the Arthur and Starr report, I'm assuming most of you have, or you will in due course, actually, to be fair, it does convey some of the uniqueness. These are particular families in particular circumstances. The dynamic of individual workers, individual agencies, of race, of culture, of the organizational culture, the systems, the challenges that people have. Each case is different. Now, they look similar in a sense. You say, oh, domestic violence, mental ill health of the mother, alcohol and drug misuse. Yeah? When you get looking at those general things, well, they all look the same. But they're not. I think that's really, really important to hold on to. That's one of the risks, one of the dangers, I think, of practice reviews, serious case reviews, is that they've tended to make it look a bit too simple, a bit too predictable. Oh, all these cases are the same. They all involve domestic violence and so on and so on. Yes, domestic violence or whatever is often there, but the way that it interacts and works in that particular case with that particular worker, that particular agency, that particular neighborhood, that's different, and it isn't predictable and it isn't simple. And I think sometimes we look for the similarities when what we actually could be doing to learn more powerfully is looking for the differences, looking for the uniqueness. I think that would help. So they're sort of, they can tend to be the same in a rather superficial way, I think. The other bit then, the national context is important. Of course it is, the national context about resources, about workload pressures and so on, about the national policies that we have. I know the spread of signs of safety, and the law, of course, the law which take children into care on the basis of significant harm. So some form of harm is allowed, in a sense, if that's not quite the right word to use. Children can suffer harm and still be at home. We all know that. That's why we have child protection plans and so on. So you're working in a national context, but I think you have to be careful about drawing national lessons. Understand your local lessons in a national context rather than looking for national lessons, which I think can be a bit misleading. Donna, do you want to come back on anything? Oh, you just ducked down. Do you want to come back on anything there, or does that seem okay?
Sorry, yes, that seems okay. I can't see anything in the chat about that, but I guess that the only thing that I would say is if you've got, when we talk about the shortcoming itself that led to the review, if there's something national that's causing this shortcoming, but you're in a local review, what are we going to do there? So now we're in two systems. Is it helpful? I mean, from the Starr and Arthur case, I can't, here's an example. I in my local review cannot recommend the introduction of a multi-agency child protection unit. I can't do that. But there might be things on a national level that I want to lobby for, write letters about, etc. We're still doing that, aren't we?
Yeah. No, I take that point. I guess in a local review, you can raise issues and you can put them to the national panel. I know some people have done that. Particularly, I know some people called for a review of adolescent suicides, which the national panel didn't do. But you can sort of try and ask them to do things. But I think, yeah, there's two points in response to what you say. One is I actually think the local lessons are where you can make the most difference in a local practice review. That's the word local. And there were some great examples of that happening. We'll talk about that later. Not just training, but actually service development things, which can be implemented relatively quickly, relatively inexpensively. You can get on and make a difference. So your practice reviews are all sent to the national panel. They read them all, and they genuinely do read them all. They discuss them in their regular meetings. You can be sure of that. So your messages are getting across to the national panel. So I still say you've got to understand your local difficulties in a national context. But I would say what your local practice review can do is make your local plan for action. But going back to what Donna was saying, I think there is a risk. The risk of local child safeguarding practice reviews is that the local agency gets the blame when it goes wrong. I think that the title is quite a giveaway. I think local child safeguarding practice reviews. They're focusing on local practice, not national policy. The name gives it away, and there is a bit of passing the buck. I think, the local people didn't do it right. That's a bit of brutal political reality. I think you do have to be alert to that. You have to try and resist it. You also have to try and bring that national context to awareness, I think. But I think in terms of making a plan for action, you start with a local, and that's where you can make a difference.
Thank you, Jonathan. So helpful. A couple of comments that are coming through that they don't think they need to wait until Q&A. Meg likes the uniqueness of the family rather than overgeneralizing. Nikki says she focuses on the themes rather than individual agency blame. I think we're going to come to blame, Nikki, which I'm so pleased that you started us off on that. So thank you. So let's move to another question for Jonathan. We'll definitely, if there's anything else coming into this chat, we'll capture it for later about that. Anyone who reads anything that I've written, and on all sorts of social media posting polls about it, because I love to hear what you say about this. So this could even be my favourite question today. Is there a danger of deciding that a theme is recurring just because we're using a vague term or a misleading term? Yeah, is it really a recurring theme? That's my question. How do we decide that?
Yeah, and my short answer to that is yes, absolutely, there is. And I think perhaps the obvious example is information sharing. There are problems with information sharing. Yes, I bet every single review says that. But it's not the same problem every time. There's all sorts of different problems about it. One problem might be that the worker who had the information didn't realise it was going to be important to somebody else. Simply didn't recognise that this is an important piece of information, that they've not attended the GP or whatever, or they missed the health visitor's appointment. Another person might receive some information and not recognise that it's important. Perhaps there's a bit of professional jargon. The paediatrician uses a medical term which the person receiving it doesn't recognise, doesn't realise that's a clue to something important. So there's those differences. There are simple differences that maybe the information isn't transmitted correctly. You send an email and it gets lost, or you're using some sort of IT system and the message is swallowed up by the IT system. These things happen. It arrives, but it's not read. It's lost. So information sharing is, I think, once you start breaking it down, it's a different problem, different sorts of things. And that's why it looks like it happens all the time, but it's not quite the same problem each time. So that's why we need to look at it in depth. And the lesson that I get, I think, from reading these reviews is don't muddle up information exchange with communication, right? They're not the same thing. If you want to really communicate, I think you have to talk. I think that is the golden answer. I know it's difficult. I know people are pressured, heavy workloads, but there is no substitute for a conversation explaining what those words mean, why you've got this concern, why it's becoming cumulative, allowing the person to ask you questions, listening to what they say, as well as saying what you say. So that's, if I give a golden tip, I'm sure you all know it: talk and listen and talk. Don't just rely on filling out forms, referral forms, and sending them off into the ether, because it may not happen. All sorts of difficulties of professional, different professional understandings. It's, interagency communication is difficult. I think there are some misconceptions about privacy and confidentiality. There are some proper concerns about it, but also some misconceptions, and people who are busy sometimes don't explain the information as well as they should do. Any other thoughts, Donna?
Yeah, under information sharing, for instance, I have been saying, I'm force you in my mentoring of you to separate information sharing into I've got 7 different categories, because I wasn't going to allow it to come under one umbrella. And even in the examples you've just said, you've added to my 7. So yeah, I think it's a real issue, and I think it's a dangerous issue because of how it can make us all feel. And it's a dangerous issue because we've got to think about how we fix it and the recommendations as well. So we'll come to that.
And then another thought I've had about this idea of using these general terms which actually cover lots of different things. I think, well, 2 things to say. One is, I think sometimes reviewers or reviews latch on to cliches. Certain buzzwords become popular. So professional curiosity is a good example. I know others I see: think the unthinkable, disguise compliance. And people say, here's another example of disguise compliance, or here's another example of not showing professional curiosity, and type it into the review as though that's the answer. The professional curiosity one is, I must admit, one that really gets to me. I read people say the worker should have shown more professional curiosity. Ping. Like, well, okay, go another question yourself. Why didn't they? What was it that stopped them asking the next question of the mum, or checking out with another agency? Just saying they did not show professional curiosity really doesn't help me, and I don't think it helps anybody else. So why didn't they go that step further yourself? So that's another lesson about looking out for cliches, going a step beyond them. There was something else I was going to say. Slipped my mind. Anyway, we'll come back to it. I'm sure it'll come back later to me.
I think
anyway, that was that point.
I think it will. I'll add in some comments because Jeff's talking about this interagency communication idea as an issue. And he said in one review, he was critical of the quality of minutes of strategy and core group. Is that child protection meeting? Sorry, my chat box moves too quickly for me to talk about that. And Julie's agreeing that information exchange is not communication. Maybe the question should be, why are... the chat box. Can you see that, Jonathan? Why are the practitioners, managers not talking to each other?
Is it resources / organisational culture? Is that influenced by national policy outside the control of the worker and manager? So, yes, I think culture is a part of it. What happens, I think, particularly, I hear this from the schools, actually, interestingly. Schools, it's not unusual to hear them say things like, we tried to refer a case of this nature and it didn't meet the threshold. We didn't even get a response. We didn't get any feedback on what happened. Meh, we're not going to bother next time. So that an unhelpful sort of local culture, that word local again, that local culture, maybe even just in that particular school, people talk to each other and they say, oh, what's the point? So that's got to be a breakthrough. That's about actually, giving feedback to people who make referrals, even if you don't think it's met the threshold for you to take further action on. You get back and you say and you show that you've taken it seriously. So there are some lessons there. So it's about local culture in that sense, I think. National policy, yeah, well, I think national policy, well, of course, national policy covers lots of different things, doesn't it? They don't always point in the same direction. National policy is very much about sharing information. The messages coming from the national panel and the DFE and everyone is, if there's a safeguarding concern, you are not bound by strict rules of data protection and confidentiality. Share the information. That's definitely the message, but it runs up against all sorts of other messages about private family life. It runs up against messages about facts about workload and the pressures that people are under. So when we talk about national policy, we have to realise there is no one coherent national policy. There are lots of national policies locked in a sort of battle for supremacy, and that's why the job's difficult. Of course, we find ourselves on the sharp end of that.
Thank you, Jonathan. And I think so. What I see Julie doing in her comment in the chat is asking second question. She's not leaving it under the first general one. Okay.
There's another one come through. Can you see it? From Catherine.
Oh no.
Okay. She says, I think there's a real issue when there are workforce pressures in which people step down into other workers' roles. Yeah. So managers become practitioners to soak up the workforce deficit, and so time isn't protected to allow practitioners and managers to discuss and think about meaningful interactions with families and how this translates into purposeful action. So I think that danger sort of working down, yeah, and undoubtedly we see that people do it for the best of motives to help people out, but that means they haven't got the space left to do the job they should be doing. Yeah, I think that's fair. That's a danger. Yeah.
Thank you. Can we move on to the effect then? The effect that we've got a narrative that is quite prevalent. It's quite prevalent within our review community, but it's also within the workforce. And it's unhelpful to have a jaded review community, and it's unhelpful to have a jaded workforce. So let's unpick this point that's making us feel jaded about kind of, is it the failing narrative? Is it the here we are again? To be really provocative, when I was getting people to answer my poll, I said, we don't need another review to tell us about information sharing, because this is how some people just feel like it's this again. So shall we unpick that a little bit as well, Jonathan?
Yeah, I think these reviews, these national reviews, do contribute to a jaded workforce. I think that's true. The sense that it's all hopeless. And I think the McAllister review does that. And I mean, that McAllister review, if anyone's had the strength to read it, he's really bashing this line that we've got a broken system. Well, I don't agree entirely. There's room for improvement. Of course there's room for improvement. I don't think we've got a broken system, because what we miss, of course, by focusing on these serious cases all the time, we miss the fact that actually families are helped, that children's lives are sometimes literally saved, but I turn round. We miss the young person who comes into care at 14 or 15. That's late to be coming into care, with a lot of history of damage behind them usually, and yet they do turn it around. They do get a job. They do go to university. We hear a lot about these only such and such a percentage of children go to university. But you need to remember, one, it's a ridiculous comparison to compare just the children in care, if you like, with the whole population of all the middle class children with their stable upbringings. That's ridiculous. So start comparing it with like for like, the children coming from similar demographic areas. And then don't just look at the number of children who go to university at 18. Knock it forward a bit. Look at children going to, or young people starting at university up till they're sort of 24. And actually you get a much different rate, much more impressive, much more surprising, really, how many do manage to do that. So sometimes we notice the failures. Perhaps we're social workers, we're people who, you always want things to be better, but we need to be better. And I think national politicians and managers and so on, policymakers and leaders need to be better at recognizing the successes. McAllister refers to some he's very grudging about them, but they are there. So recognize the successes. Recognize too, I think, that it's not just serious case reviews that create a jaded workforce. Ofsted inspections, they are devastating. If you get a bad Ofsted report, it's devastating for morale, staff leave. Bradford, of course, where the Star case happened, is a good example of that. They're in desperate trouble, and they've been in desperate trouble for a long time. So recognize there's lots of other pressures as well as just serious case reviews. I think too, I think about the people who come into my course. I teach social work. We have people coming in, a variety of ages, variety of experiences, good people. Okay, I'm going to say this: good people in both senses, with good hearts and good heads, and wanting to make a difference and wanting to help people. And I'm always encouraged and enthusiastic, so I try not to get jaded. I look at the next generation of people coming through and I think, this is good. I'm glad we're attracting people like this, and I want to help them to make a difference. And the great thing about social work, and I suspect other professions, don't think it'll come from other professions, health visiting or whatever, there are different ways of making a difference. You don't have to be in the front line all the time. I think we should recognize that. Go into different roles, work for different agencies, keep your motivation going that way. So I try to be upbeat about this. It's such an important job, such an important job. Sometimes we are literally saving people's lives, and even if we're not doing that, we are helping to transform lives, and I do think we can do that. So clutch onto those positives. That's one of my messages on that.
Thank you, Jonathan. And there are other professions working in our sector, as you've referred to, and their inspection regimes perhaps are creating a headline that's something similar around this failing narrative, which of course is how the wider public will then see the situation. It's what's really a great headline for media. I mean, it seems to be what comes through the courts ends up in the media more, doesn't it? So, and of course, we're affecting workforce retention. We're affecting those younger people about their choice of profession. So I do think there's many layers to this. And if we're feeling this way, can we make the internal shifts to see whether, to just be examining of whether is this definitely a recurring theme, or can we send it off into one of these 7 different categories and analyze it with much more sharpness before we do send out this narrative of failing, recurring.
And then just to thinking about that, I'm thinking of one of the lessons that struck me very much from an agency. We had some online focus groups and so on when we were doing these reviews, And I remember one local authority representative talking about work that they'd done arising from a serious case review, which was about sexual exploitation of young women. And they'd done work with the licensed trade, with the nightclubs, the taxi drivers, and so on in their city to help increase their awareness of, is this straightforward what's happening here? This young woman looks, maybe she's under the influence of alcohol or drugs. What's going on here? Sharpening their awareness of that, giving them phone lines to call, giving them training, and not just a one-off basis. She actually got an ongoing system of regular training, regular consultation with these businesses and the people who work for them. I thought that was tremendous, really tremendous. That's not going to stop it always happening, but it was a real concrete service development, not just training. When I talk about training these things away, it's a different sort of activity, and it arose from a serious case review and people making a difference. So there's some of the positive things I think that I hope will help people get over the jadedness. Look for those new schemes you can develop.
Thank you, Jonathan. And I wonder if some of those things are a bit easier to retain in our mind going forward than lots of dense theory-based training, which sometimes is what comes through. I'm going to ask if we, Paul, would you mind if we take your point into Q&A? Because I would really like Jonathan to take us into some depth on that one. And I'm also going to, the relational and compassionate approach. So thank you. Moving on. So we've talked about the narrative that we're failing, it's recurring. Is it worth it? But what about the effect of the public or our impression of reviews? So is there any point in us doing another review? Reviews don't work. Just adding more and more recommendations of the same. And I heard it so strongly around December last year. And I know that people, well, we've talked about hearts. People's hearts were breaking when they heard those two cases coming, into the headlines so quickly upon each other. And people in very influential positions were saying, these reviews are just churning out the same recommendations. So I think it is really important for us today to address whether, if it really if you've gone through my very meticulous, is it really is a recurring theme? Yes, it is. Can we move into the power of the review when that really is arising? Because it does arise.
Okay, yeah, I think a number of things to say to that. One, I think actually we probably can be, I think, a bit more discriminating, discerning about how many cases go into full practice reviews now. We have this two-stage process now, the rapid review and then the practice review. I think people could look a bit more at, can we make the plan that we need from the rapid review? Do we really need a local review? What are we going to learn that we haven't already learnt from that? So I think there is a sense maybe we could have fewer reviews. I think that's one point I'd make. I've discussed that with the national panel. I think they were sympathetic to that. Against it, what you get when you have a practice review rather than a rapid review, you get, of course, the practitioner involvement, you get the family involvement, and you get the publication of the report. And those are all important things. Important for learning, but also important symbolically almost, I think. If a child's died, you can't say, oh, there's nothing to be learned from it. Oh, a child's died, we're not going to learn anything from that. You just can't do it. It wouldn't be right. So there is a pressure to have reviews. That is for sure. I think people could perhaps, though, still try and have fewer. You could maybe publish a summary of your rapid review. You could use your communications and your media and things to show that you're taking it seriously, that you're learning the lessons, that you've looked at the lines of accountability and responsibility and so on. So that's one response to that. Another one about the repeated lessons. Yeah. Sometimes I think we do have to repeat the lessons. The workforce changes. We get different people coming in all the time. I bet there's hardly anybody here who's got the same colleagues, the same team colleagues they had a year ago, never mind 4 or 5 years ago. So, you know, a maths teacher doesn't say, oh, my system's failing because I have to teach calculus again or whatever. It's a new generation and you have to teach the calculus again. So that's another side of it. These are really important lessons. We do have to repeat them. I know you might say, well, what are you doing on your qualifying program? I can assure you we're saying them. I can assure you we are. But sometimes, you know, people have to live it, and it has to be, and it's in an organizational context with those unique factors that I talked about. And the third thing I'd say about this idea about the messages repeating, and it links a bit actually with what I think about the Arthur and Starr review and the McAllister review. There's a bit of magical thinking in it. A bit of magical thinking. If only we can get the right structure, if only we can get the right sort of practitioners, if only we can get the right training, then we'll solve this problem once and for all. And we can't, because people change, because some of the tensions are insolvable about family support and child protection, about allowing time for change and not allowing drift, you know, about saving money for all the families on your caseload and spending money on this particular family. Really insolvable dilemmas. And if we had a system that didn't allow any risk, if we took children into care as soon as there was the slightest inkling of a risk, that was what said Nadeem Zahawi said, didn't he, in the House of Commons after the Arthur report. We'll have children taken into care where there's the inkling of a risk. No, we won't. Think what would happen to the foster care system, think what would happen to the court system, and think what would happen to any vestiges of trust with local families and the families we're working with. We're just going around to like the child catcher in Chitty Chitty Bang Bang. We can't be doing that. We leave children at home in situations of risk. And the nature of risk is that sometimes there'll be bad outcomes. And I think we need to be putting that message across. It's not a comfortable message, but I think that is one we need to, you know, perhaps me as an academic, you as professional leaders need to be saying. Not you know, it's not, you can't say it in a press conference when a child's just died. That's not the right place. But when the atmosphere is cooler and there's opportunities to be a bit more reflective, I think that's a message we need to be getting out.
Thank you, Jonathan. So the points arising for me there are that it's not palatable, but sometimes we have to sit with the discomfort that these themes are recurring and they are here, and that's our reality. So for me, when this was arising in a recent situation like this one, I referred to it in August, I was kind of reflecting on the fact that, you know, as humans, we did manage to achieve space travel, but it wasn't on the first go, wasn't the first time we had the idea. So, you know, this idea of a wicked problem, this idea of a problem that's got complexity to it, would we expect that we're just going to crack it? That we're going to crack it locally, you know, because that's the system that we're working in. That seems quite unrealistic to me. But also, if we're in a review, the challenge for us is to generate new learning, a new fix for that problem. And, you know, this is why we have our masterminds. We've got a mastermind coming up in our CPD team about this, because we need to mastermind, you know, what happened last time, what worked well in the fix that was applied last time, what's going to be new next time.
Yeah. Yeah, and I think, but another question is have you actually done what you said you were going to do last time?
Yeah.
And again, I'm afraid to say that in some of our reviews, there were reviews where when we went back, we found that the recommendation had been made in a previous review, even in the same authority, it hadn't happened. So there are those things about, are you getting those smart action plans? Are you actually doing them? And are you then, reviewing them or auditing them and making sure you have actually done it? So yeah, it's about building on what you've tried before, that's for sure, but making sure you've done what you said you were going to do before as well.
Thank you. And thanks for the points that are coming through. Josie, about relational practice. Kate, about the national panel's approach to the rapid review doing that work. I'm going to take those both into Q&A because I think they're a point to debate and speak about with Jonathan. But just to finish this point off, I think that Kate's point about impact being rarely tested. So it's great to hear that we take the training one. It's great to hear that this training took place. How many were you able to capture, and from which areas of the workforce? Asking those questions about last time's fix might help us to know what the next type of fix we're going to apply to be useful. Nikki's agreeing about the impact. And I think that to get the most value out of each review, is that something we as a system could look at to have that evidence before us? It's quite hard to get to when you're in that review. Okay.
People did talk about that in those, I've mentioned these focus groups we had. People talked about doing audits, going out and interviewing practitioners and interviewing service users as well about whether they'd seen any difference. I don't know if other people do that sort of thing. But yeah, there are certainly some areas are trying to do that, that's for sure.
Nikki, I'm sorry if I've just misinterpreted what you said. It sounded good anyway. I think it's good both ways, that comment, Nikki. Okay, so last one, and we've got 6 minutes for this one. We have a tendency in our recommendations, let's all own this one. We do love to use the training recommendation. And I don't think anything that we talk about would ever undermine that training recommendation is so often very useful indeed. But then when it's overused, or if we jump to it a little bit too quickly at something to grasp at, we could get into train it away. Let's just train away the problem. It'll be fine. Train them up. So I'm turning it into a caricature. Of course, none of us think like that, but I'm turning it into a caricature so that you can help us to unpack the problems with that. So, yeah, what are your points for this, John? I mean, I've got a couple. What are your points for the training recommendation?
Well, I say, yeah, you're right. You can't just train them away. But on the other hand, don't knock training. It's about the variety. I think there's a message about the variety of ways you do it. And again, we did find, when people talked in our focus groups, there's a lot of different ways they do it. So people produce these 7-minute briefings or whatever. They're fairly standard things. But people produce sways. People know that. Microsoft Sway, they're quite fun, quite good way of getting info out. They do face-to-face training. They do some training as part of NQSW sort of packages. Other training, one-off bite-sized chunks, online training sessions, some in the evenings and so on, so that people can attend in the evenings. I know you say, it's more my own time, but if it's when you're available, then that helps. So there were some good innovative ways of doing it. And I'm talking about social work. I must admit, I've just realized I'm talking a lot about social work. That's my area. But we've got to remember there's a whole other range of other agencies involved. The health side, police. I think actually reaching police is a challenge. But they're part of the statutory partners. Schools. I think both the McAllister Review and the National Panel's Arthur and Starr Review are both saying that schools should be back as statutory partners. Quite right too. Why they weren't in the first place is really hard to understand. But getting messages out to teachers as well, I think, is really important. So we've got to think about So I think that the challenge for training actually, I think, is to get it to those other groups. I think that would be a good thing to do. Then I think, like I said earlier, I think we have to accept we've got to do it again and again. That's part of the reality for new generations. But I think we also look, as I say, for things like service development and so on. The example I gave of the work with the licensed trade and hotels and so on. Another example we got about was about, encouraging condom distribution and so on. So there are practical elements that you can make, and I think again, what really, genuinely I was enthused by, not to be jaded, that sort of idea, was the level of determination and resolve and imagination that local agencies, safeguarding partners, were showing in trying to get the messages out. I thought that was good.
Thank you. I think I have often appeared to be anti-training in the recommendations. Have I gone too far with what I've said? So the way I feel is that it's least acceptable when that recommendation is placing too much burden. So we're saying, now you've been trained on this, there's an expectation on you to kind of maneuver around in your day-to-day work, applying it everywhere that we expect you to, and retaining it. So I feel like could partnerships instead be the hub for the information, the go-to, instead of, there you are, we've trained the situation, rather than the reality of what's been retained from that. Or that's the part that's difficult for me.
Yeah, I see what you mean, and I guess that links a little bit about supervision, and the sort of ongoing support stroke challenge that you get in supervision. And again, we know that that the reality doesn't always live up to what we would like for, in terms of that regular, well, you need two things. You need regular reflective supervision, and you need on the spot sort of emergency supervision. This is what you do now. And you need supervision that asks some of those hard questions about practice that I mentioned earlier. About practice is often a bit of a gap in these reviews, I think. And we need practice supervisors who ask questions like, so when Mum told you that the bruise had been caused when the girl fell off the settee or whatever, what did you say then? And did you see the bruise? Did you see the settee? Did you see the child's bedroom? What did you see when you looked in the child's bedroom? Pushing some of those hard questions. I'm not sure that supervision always does. I think that's a key target, I think, for training and support as well, to get that level of frontline supervision really on the mark, to really help our staff to do that work.
Thank you. So we have just phenomenal people here, alongside you, Jonathan, to talk to about training. We've also got Nikki, who's going to offer us some thoughts about training packs, impact return form, learning from reviews in level 1, and I'm going to take that to the Q&A. So I've selected my 4 issues to take to the Q&A. I'm going to finish up with a few slides so that then we can just get really kind of open mic and leave the old chat box alone.
Great stuff.
It's a bit better, isn't it? Okay, so we've talked about a lot. Is there anything in this 1 to 4 that you would implement now? Can you set an intention to be really separate and explicit about a local problem and a national problem in your approach? That's a 1. So there's no local blaming if it's a national problem. 2, would you like to avoid these kind of predictable and banal lessons by being more specific? 3, you're going to use language to avoid that recurring failures narrative if you believe that's correct. 4, all of the above. Ellen is a 4, Nikki's a 4, Emma's a 4, Kate is a 4. Hannah is a 4 with an exclamation mark. I love that, Hannah. Steve's a 4. Katie is a 4. What a brilliant way for us to all make a commitment. Robin's a 4. Catherine's a 4. Carol is a 2 and a 3. Thank you, Carol. I had to think about that. Thank you. The recurring failures. Rachel is a 4. That makes me feel pretty upbeat. Margaret's a 4 as well. And Margaret is out there in those reviews, so we know that it's going to make a difference. Thank you. So I'm going to leave the slides behind now and we can start some Q&A about recurring themes. If within this Q&A you want to stay around until the end when everybody's gone, also I will stay if you've got any training queries. So, Jonathan, are you ready for picking up some of the points that were in there? Did you see the point, Jonathan, raised by Paul, which was about a more compassionate and relational approach, which could potentially have a positive effect on the stability that we want to create for the workforce?
Yeah, I think Paul's making the point. He says, in the profession and towards it. Yes, I think that's a nice point. We talk a lot about relationship-based practice, don't we, with our families, relational approaches. There's a point about using it ourselves, between our colleagues in practice. Let's remember that, how important are peer support and friendship and those conversations you have are after you've had a difficult meeting. Maybe your supervisor isn't there, but you talk to a colleague. So that's really important. And then towards it, can we get that coming from people outside towards us? That's a bigger challenge. I think if only they could, but I think sometimes I fear social workers are a bit a soft target, aren't they? Is Paul still there? Do you want to add any more to your thought, Paul?
Hi, Jonathan.
Hi, Jonathan. Hello, Paul.
Hi. I think probably, I suppose the point I'm making is that the lessons learned are often sort of seen in fairly transactional terms. So it's like we've learned something and then we do something, and the whole context of improving children's lives gets kind of lost because it becomes a bit of a checklist. We've done it. We've got this problem. We've got the solution. We've done it. Rather than looking more broadly at contexts in which people are working. And so one of the things that I would sort of recommend very strongly is that whenever there's a serious case review or a rapid review or a practice review, the first person who gets interviewed is the senior manager in the organisation about what their thinking is about what's happened and why. And we never see that. We never see senior officers being interviewed to try and explain what they think the context of their organisation is, and to talk to them about how they feel that may or may not have contributed towards what's happened. And so there's a kind of we start with the incident rather than the context. And sometimes I think it might focus senior managers' minds if they were always the first person interviewed, and their thoughts were actually incorporated into the review process, and then they were asked to personally take responsibility for how recommendations are then implemented. I still think there's a bit of sort of sidestepping. I can say this as a senior manager, by the way. There's a bit of sidestepping that goes on in organisations, and senior officers aren't kind of asked to account for what happens, which is unusual, isn't it? It's a bit of an odd thing. Sorry, that's all I wanted to say. So it's just more about the kind of context.
Okay, I think someone has chipped in. I don't know if Kate is responding. We do this as a regular activity. So is that about, were you meaning, Kate, about interviewing senior managers as well?
Yes, yeah, senior managers. So we would, from several agencies where they have involvement with reviews, we would interview them, if you like, with some structured questions.
Yeah, I mean, I think that is important. I do think a lot of places do that, actually, from my reading of the reviews. And certainly if you read, when you read the Arthur and Starr review, they've certainly done that. They've tried to set their analysis of what happened in the bigger context of the pressures that Solihull and Bradford were under. So I think that's right. I think that should be, if it isn't happening, I think it should be. And that information that they give then weighed against the information of the frontline practitioners and the families, if you're able, and young people, if they're able to participate as well. Yeah, Donna.
Okay, thank you. So let's move into, so Josie spoke to us a little bit about sort of relating the rapid review and the local child safeguarding practice review, and also it's really important to bring in Kate's point. So let's talk about rapid review, child safeguarding practice review. One point is how the national panel would approach it if a lot of that, you called it excavating, Jonathan, is happening in the rapid review. And Kate's saying, yeah, it seems to be acceptable to the national panel. Josie was saying she chaired and authored the rapid review and then was involved in the local child safeguarding practice review. And I almost got a sense of spaciousness that created, Josie, from saying we're going to be really strategic in part one, which is the rapid review, and then we'll go more of an appreciative inquiry focus into the child safeguarding practice review one. So Jonathan, would you like to comment on any of those and bring anybody in?
Yeah, that sounds good. I mean, are you still there, Josie? You want to say a bit how it actually worked? Yeah, hi.
I am, and I was just, I think it was right place, right time, and I just was there and doing something, another piece of work, and the case came along. It was fairly shattering for the whole safeguarding system, working with a young person who was a victim of knife crime and lost his life. And of course, you know, tensions were incredibly high. There was a lot of publicity around the case, and there wasn't anyone right in the right place to be able to write the sort of review that needed to go with the rapid review. So it was a way of being responsive to the needs of what was going on. I was also really aware that there was a lot of need for compassionate practice at that point in time on the part of the reviewer, because so many people were involved in the case, a lot of people, perhaps too many people, came to the rapid review, but it meant that I think I chaired it in a way that meant that they didn't, it was reasoned, it was proportionate. But what it allowed was for us to tail off some of the things that we needed to say quite quickly, as a matter of urgency, to kind of make some sort of strategic changes. And also some national issues. And so quite rapidly we were able to go back to the national panel, and say, we've got a real issue with this whole concept of housing, and housing not being on board when you're trying to move a family temporarily, albeit to a safer space. There's an issue with this, about them responding to that as a kind of management and some of the contextual extra-familial safeguarding cases. And they took that on, because we did that bit of the review so quickly, so they took that on quite swiftly and acknowledged that they were going to be looking at thinking about how they could address that. So we got a lot of responsiveness from the panel. It also just meant then the review said what it needed to say. And so when I went on to the next part of the review, it was really very easy to do that appreciative inquiry, because some of the other bits had just been tailed off, really. And that's what was needed, because in fact this young person had some fantastic intervention at the highest level of risk with agencies that needed to be showcased in a way, because actually his death was totally, in many ways, preventable. However, he had made a choice to go somewhere where he shouldn't have been, and he knew he hadn't, he was not supposed to be. And so I think it was a real opportunity to redress that balance with the system and with the practitioners working around him, because of course there were feelings of guilt, shame, having got it wrong, inevitable blame, and it was just an opportunity to write that as well. And I think what we got out of it was a much more useful exemplar of what good practice looks like, particularly around engaging with young people around their culture and what makes them become drawn to gangs. And actually it kind of worked quite well. So, and it got done in 7 months.
Did you get that message, those messages out sort of beyond the agencies to the family, to the general public? How was that received there? Because I do think, I think the practice reviews they're about public accountability as well as learning lessons. I think we need to be honest about that. And did that manage to do the job there?
Well, the one problem with that one, Jonathan, is there's still criminal proceedings. So, of course, we have to be quite measured in terms of that. Trying to engage with the family. The mum didn't want to do it, although I'm due to go back to her because I said I would go back to her in 6 months' time and talk to her about it. But, I'd like to think.
Hello. You just muted yourself.
I conducted most of the review in the pupil referral unit that he attended. Okay. So actually I became a bit of a kind of part of them for a little bit because it really helped visiting and going to assembly and talking to the children and young people. So, as much as I could do at that point in time, there was a little bit of influence beyond just the doors of, statutory agencies. I'd like to think. That's
important. The other bit interesting, just what you mentioned that you said a black young man, did you? You said?
It was from a mixed heritage background.
Yeah, but it sparks up another thought, and this is such an old lesson. It goes back right to the first of the DFE commissioned reviews of serious case reviews. Talked about in 2001, it was published. Talked about a lack of exploring the impact of race and ethnicity in children's lives, and here we are 21 years later, and I'm just writing the same thing. It was astonishing.
Yeah.
Sometimes race was never mentioned. We found out the race maybe on the SIN, the significant incident notification form. Sometimes it was in the rapid review, but then it might not be mentioned at all in the practice review. And there were even a couple where the rapid review had said, please examine the impact of race and possible racism and so on in the way this case was dealt with, and the review didn't address it. So I think there is a real issue there about perhaps it's a bit in the too difficult box sometimes.
But this is what this review was.
Use the wrong word, and they're in trouble. But I think that is a real issue we've got to address.
And the language, Jonathan, because in fact, if you go and look at it was hard to escape report from the national panel, the term racism isn't used. The words racism is not used, and it's only, I think, now I can see with the HMIP's report into the experiences of Black and heritage young people in the criminal justice system that we're beginning to talk about racism and the impact of racism upon young people's mental health, upon their behaviours as a driver for them to seek out people who are like-minded. So it's an interesting one, but we need to be using the terms racism and anti-racist practice.
Yeah, really. And there's stereotyping that goes on, and the word I use a lot is adultification. I'm sure people if you don't know that one, you will know it soon. It's becoming more prevalent. It's about treating the children as responsible for their own actions in a way that is unrealistic. It's not fair. And maybe you would treat a white child of the same age differently to a Black child of that age. So I think that's an important concept. Again, with that warning that I say about things becoming cliches and being taken on, but using that as a key to exploring your practice with children from Black and minority ethnic backgrounds.
Thank you for bringing that through, Jonathan, and thank you, Josie. On Thursday, we've got one of these workshops, and it's about exploitation, and we've just brought through two of the main key bullets about race being missing in reviews, and also about adultification bias and the impact of child cues. So if that's of interest, that's coming up as well, but thank you for bringing it through here. Final, we still got you, Nikki Thorpe. You've got some interesting thoughts to share with us about training. So a training pack, an impact return form. And in the meantime, we've got a point while we wait to see if Nikki's with us. Louise is saying the language of diversity seems to have taken the place of the language of racism, and so oppression gets ignored. So, Jonathan, do we mention diversity? Nikki Pettit.
We do mention diversity. I think that's an interesting point by Louise. If I understand it right, is it a bit? You're saying it's a bit softer, if you like.
Yes. I'm saying that that diversity misses systematic oppression, but it talks about difference. It doesn't talk about the roots of oppression in the same way that racism and sexism and so on does. So I think the message has become, the concept has become incredibly watered down by diversity. I see diversity and diversity training as a nice liberal response to the anti-oppressive training and practice that used to be around. And I think that I think it's easier for people to talk about diversity than it is for them to talk about systematic oppression that is racism and sexism and so on.
Yeah, I think you probably agree. You've got a point there. So that's what we've got to look out for and make sure that we do keep that focus on that racism, sexism, disableism as well. I think we know that children with disabilities are more likely to suffer significant harm. So we need to keep a focus on that.
Thank you. And thank you, Louise, for that thought too. So Nikki Pettit thinks Nikki's left, that Nikki Thorpe has left. What Nikki Thorpe was telling us about was the development of a training path, use of an impact return form, which would make that data easier for us to see the next time we come into a review and see the recurring theme. And she was talking about including learning from reviews into the level 1 training. So I am not intimately familiar with what would normally be in the level 1 safeguarding training, but it sounds like this is an innovation. So yeah, and Meg saying that interviewing senior managers, she believes, is a good idea.
Yeah, and Julie Evans is making a point about, again, linked with the training. It's about being clear what the expected outcome from the training is if you really want to measure impact. The training can be innovative, delivered in a variety of ways. That's relatively easy to do, but ultimately the local partnership has to own what they expect from it. Yeah, fair point. And then try and measure it. I agree, capture it. Yeah.
Thank you. I think we have picked everything up. Would anyone like to just open mic and share anything? We've got 4 minutes left. If there's anything left to be covered, or yourself, Jonathan, if that's triggered any thoughts.
I think I'll probably about talked out.
Yeah. So. Wow. Okay. So it remains for me to thank everybody for a really rich conversation. Thank you so much to Jonathan. As I say, this will be available and a summary of it published, but you've really made it rich and far more than it really started.